Hi, I'm Colin Hung, editor at Healthcare IT Today. I'm joined today by Dr. Betty Rabinowitz from NextGen. Welcome to the program.
Thank you. It's good to be here.
Now, Dr. Rabinowitz, can you just give us your title and what you do over at NextGen?
I'm Chief Medical Officer at NextGen Healthcare. I've been with NextGen since 2017.
And now we're all together in the middle of this crazy time talking
Indeed.
about technology and how it can help.
Absolutely.
So, let's start by addressing that actually. So the COVID-19 crisis has spurred rapid adoption of telehealth technologies. I mean, I think we've probably seen more telehealth visits happen in the last month than we have in the last 2 years. It's actually been pretty incredible. Do you actually foresee that physician practices are going to adopt telehealth at the same degree that hospitals have adopted telehealth?
I think absolutely. You know, we serve the ambulatory care space. So actually, most of our clients are in the ambulatory space. And what we've seen is a huge uptick in adoption of telehealth. Think about it. Ambulatory offices end up being the front line for patients concerned that they may have COVID, or patients who are infected are oftentimes first contacting their primary care offices, and telehealth has been a really important technology for these offices.
And do you see, are there any special barriers or anything that you're seeing that physician offices have regarding telehealth that maybe a hospital doesn't have?
You know, in the past, the compensation structure for telehealth visits was very restrictive in the ambulatory space. Basically, patients had to be in an office, even if it wasn't your office, obviously. And there was a very narrow definition of the kinds of visits that were covered financially. With the relaxation of those rules, both by CMS and many of the commercial payers, ambulatory offices, basically those barriers were removed, and ambulatory offices were able to clearly adopt and start implementing these visits.
Well, let's hope that those changes are going to be permanent.
Exactly.
Because it sounds like that was a pretty significant barrier.
It absolutely was, and my sense is that patients who have had such a positive experience with these visits, convenience is so important, safety is so important, are going to expect and demand that they continue having an ability to have these visits when the COVID pandemic is behind us.
It's interesting you say that, because I was recently talking to a friend of mine who had never used telehealth before, and whose doctor had never used telehealth before. And they got on because she needed to get a prescription for her young child. They got online, spent 5 minutes chatting, and was able to get the prescription that she needed. And both of them commented apparently at the end that this was so much easier than having to go into an office. And
yes.
Are you hearing that same reaction?
No question. You know, when you think of it, people have to drive to the office. They have to find parking. Many who are employed have to take time off work to get there. Waiting rooms are complex environments, so you're sitting with people who are coughing or sneezing or sick, especially in this time where you're concerned about contagion. So it clearly, for certain types of medical issues, is the way to go. You know, some visits will need to continue happening in person when there's a procedure involved, there's a testing activity that needs to occur. But for many visits, this is a very useful modality.
And on the topic of permanent change, do you think that this telehealth and what's happening now will have a permanent impact on physician office space? Like, will we, for example, see the no more need for waiting rooms and those kinds of things?
It's a great question. You know, during this pandemic, waiting rooms have been under duress from a variety of directions. One is telehealth visits. The second is even offices who've been seeing patients in person have tried to not congregate patients in the waiting room. So the check-in activities have been shifted to cars. People are texting from their car to say they're in the parking lot, and they get a text saying your exam room is free, please come in. Or some of those check-in activities have been shifted through patient portals and patient engagement platforms to being done by patients at home. So patients are checking in before they actually get there. So suddenly every office has several hundred square feet of a space that has been basically decommissioned during this pandemic. And I'm sure people will be asking the question, which part of the waiting room needs to come back? How do we need to equip it differently? You know, do we create social distancing? Waiting rooms have chairs currently packed in for kind of efficiency very closely. Will we change that? Will offices really move to having very small areas rather than these large waiting rooms where we don't anticipate patients feel safe congregating for a while?
Yeah, I mean, I think you're absolutely onto something there, because most restaurants don't have very large waiting areas. They page you when your spot is ready. They let you walk around the mall or whatever area that they're in. I can totally see what you're saying would lead physician offices to shrink the size of the waiting room and allow patients to kind of wait in their cars or wait in a more comfortable, more isolated spot.
Space, yes. And you know, there's some questions about staffing in offices, because if less patients need to be roomed, less patients need to be weighed and blood pressures taken and actually seen in person, the staffing change, the ratio of staffing to patients change, and do staff need to be trained differently? So is their skill set need to be adapted to this new era?
Well, let's talk about that actually. So training, I think what you're alluding to is that, you know, we're going to have to train people how to interact online with patients. So whether that may be physicians as well as nurses, as well as even frontline staff to interact with people over the phone and via video. Right now, of course, everyone's learning on the fly, which is acceptable, but longer term, that might not be the best way to teach people. How do you see training needing to change going forward?
I think it's a great point. Interestingly, the technology itself is very easy to use, user-friendly. So I don't see big challenges. Certainly, we're not seeing patients having big challenges using the purpose-built, integrated into the EHR telehealth platforms. So I don't think a lot of training will need to happen around that. People are getting good practice now. I think the challenge is going to be for practice staff and providers to learn what visits in the future are suited for telehealth and what issues actually patients still need to come in for traditional visits. And that nuance between a patient's preference, which needs to be considered as well, the physician's preference, obviously, but also the clinical content of that visit, where there's no point starting out with a telehealth visit just to tell the patient, actually, I'm going to need to see you. So that's a new construct that we're going to have to get better at. But there's no doubt that much of routine follow-up for chronic conditions, with the aid of the home blood pressure cuff or glucometer, or you know, for a pediatric group, the ability to look at an eardrum or into the child's throat, will allow many visits to shift, but there will be some training needed to choose wisely what type of visit is suitable.
So that triaging process is going to be critical, and it sounds like that could be something done at check-in, or that may be a quick phone call with the person booking the appointments, that kind of thing.
Absolutely. It's a new, very exciting era. You know, there was such slow adoption of telehealth. The nice thing about it, different than EHR adoption, the software has had time to mature and increasing quality because there was a very slow ramp up. So when this incredible explosion of need and necessity for telehealth occurred, for example, a company like ours was ready with a very mature piece of software. Versus just imagine what would have happened if this would have hastily been put together. We've experienced that once around the EHR. So I think we're in much, much better shape with telehealth this time around.
That's kind of an interesting point. What you're saying is that we've had telehealth technologies for a while now. It just wasn't really widely adopted for a variety of reasons. The one you mentioned, financial, being a big barrier. So we've had more of a gradual adoption and able to iron out some of the kinks, so to speak.
Absolutely. So these pieces of software are mature, seasoned, debugged, taking advantage of cloud and ability to scale up, and extensible in kind of their ability to take on load, and evolved APIs connecting with the EHR to transfer clinical information back and forth, integrate into EHR workflows. These are mature capabilities that have taken some time to get here, which we've had the luxury of, luckily.
That's great, and it sounds like NextGen's telehealth platform you have a set of partners, or is totally integrated with the EHR.
Absolutely. So at NextGen, we really believe that in order to be effective, all of these capabilities, whether it be population health, telehealth, mobile abilities, all have to integrate into the physician's workflow in the EHR, because physicians are very fatigued being asked to log into multiple applications to do parts of their job. So we firmly believe that integration is actually absolutely key.
And in terms of changes, did you have to make any changes to your system to accommodate this explosion, from a NextGen standpoint? Or
no, interestingly, NextGen had acquired a telehealth platform some months ago, not knowing how timely that was. We just understood that it was a very important part of patient engagement going forward, separate than the pandemic. And we have been delighted with the way we have integrated that application, and also there seems to be no amount of load that we can put on that telehealth application that gets it into trouble. So we've been delighted with its performance.
That is a great story about great timing.
Yes, indeed.
So let's talk about one last thing. What do you see will be some of the permanent changes for the ambulatory world that will come about because of what we're going through now, this pandemic?
So clearly there are going to be fundamental changes. When we talk to our clients, what we hear from them is in this order: telehealth is here to stay. We hear expressions like the genie is out of the bottle, the toothpaste is out of the tube. It's not, we won't be able to return to 100% visits in person. And I, for one, think that is terrific. I think that consequently, there will be changes to delivery model that will have to do with physical space, staffing, skill sets for staffing, and kind of the ratios of those elements. The next thing that I'm hopeful will change, that we haven't had a chance to talk about much, is I think that we may eventually see a more rational approach to quality measurement in this new age. I think that there's going to be a plea to CMS and commercial payers to standardize, pare down measures, create programs that are more accessible and sustainable and approachable. Clearly, there are questions about value-based contracting as a whole, risk, how groups take on risk, and I think that some of those changes will be for the good. I think there will be a strengthening of some elements of value-based care. So I see this as a watershed event, after which really nothing will be the same. It will give us an opportunity to examine and relook at some of the things we have thought would never change. If we were having this conversation 6 months ago, and you said to me groups are going to switch 100% of their visits to telehealth, I would have said you were smoking something very powerful.
Well, and I love the examples you just gave, because I'm hoping all of those that you just mentioned are going to become permanent fixtures of the new healthcare system moving forward. And I think you're absolutely right that this situation is kind of proven to us, like, why did we have this restriction in the first place, or why did we have that red tape in the first place? It's kind of really made us look at all the unnecessary stuff we put in the way of delivering care. And absolutely. I hope, like you do, that that's all going to be eliminated going forward.
Absolutely.
So last question, Dr. Rabinowitz, what's the one thing you're hoping our viewers will take away from our conversation today?
I think that the most important is for them to recognize that in this era, in this time, in this crisis, health information technology companies are squarely behind those in the front lines. We were positioned, we were ready, we were able to help. We see it as a very important part of our mission, and that any of the challenges we face pale compared to the sacrifice, the devotion, the risk, the courage that our clients are demonstrating at this time, and we salute them.
Absolutely, well said. Where can people find out more information about NextGen?
NextGen.com. We have a website rich with content and information, and I invite people to explore it.
Well, thank you so very much for your time today. This has been a great pleasure for me to have a chance to talk with you. Really appreciate it.
Same here. Thank you.
This is Colin Hung from Healthcare IT Today. Thanks for listening.